Hi, my name is Kar Rosston. I'm the Suicide Prevention Coordinator for the Montana Department of Public Health and Human Services. And I've been asked to talk to you a little bit about lethal means counseling. Today, I'm going to be talking about a program called CALM, Counseling About Access to Lethal Means. And the steps that you want to take in talking to a patient or a family member around suicide-safe care. For the first part, we always want to explain why we're raising the question. And the bottom line is that anytime that we have a patient or a client that has significant risk factors, if they have access to either medications or a firearm, it greatly increases the risk of a suicide. So many times we want to start off by asking what are their current ways that they store firearms or medications. For instance, when we talk about which provider or which parent often brings a child into a wellness visit or a primary care appointment, most often it's the mother. And many times the mother is not aware of all the firearms that are present in a home. We also want to make sure that we reach out to the father. We also want to ask about access to all firearms, because what we know is nationally, for every firearm we know is present, there are 3 in the home. In Montana, that number is 7. So this is something that's really critical for us to ask about all firearms. We also want to make sure when we're working with kids that we're asking, where does the child spend their home? Do they spend it primarily with mom and dad, or what if the parents are divorced? Maybe they split time, or maybe they spend time in the summer with an aunt. We want to find out where the child spends their time. We also want to start talk about what are the best ways to store firearms. Ideally, of course, the best one is to remove the firearms temporarily. Now, this is a very difficult topic to talk about. And so you will get a lot of resistance about this. But if the person is willing to remove them temporarily while the crisis is being stabilized, you can suggest a friend or a relative. You always want to ask if the relative is able to store a firearm. Perhaps many times there are pawn shops or gun shops that will store firearms. And especially in rural Montana, there's many times your county sheriff will temporarily store firearms. Now, if you get a lot of resistance and they're willing to remove the firearm completely, what you can do is you can say, okay, can we agree that if the firearm is going to remain in the home, that we lock up the gun in one location and we lock up the ammunition separately? This is a fine way to do it. We do not recommend hiding guns. They're like Christmas presents. Kids know where they're at. And we also do not suggest taking guns apart. We have had many incidents where kids have actually put the guns back together. We've also had incidents in Montana where firearms that are antiques above a mantle have been used. And so that is another thing to consider when talking with parents. The important piece about this is we want to document, because this is a case where that may come into play later on if something does happen. But you want to use language such as, let's review what we're going to do. Dad, you're going to take the guns to your brother's house, and in the meantime, Mom, you're going to lock up all the medications. And then the important piece is to document your plan. Make sure that you let the family know that you are documenting it, and that you're going to follow up with them. And this is a critical component, because many times parents may say they're going to comply and they won't. But if they know that you're going to be following up with a phone call or an email the next day, they're much more likely to actually adhere to it.